Hello, good evening to everyone. I'm Dr. Philip McMillan. I've been focused on COVID 19 and specifically autoimmunity. That's where the immune system is the primary driver for disease in terms of severe COVID 19. And I've extrapolated that thinking into the longer term impacts of the pandemic and our interventions during the pandemic. And this is why I continue to speak about autoimmunity, because it is really important to understand, certainly from a clinical perspective, because there may be opportunities to mitigate disease if we know what we're looking for. So I take it as a responsibility to speak about this. Now, recently I did a presentation, or I should say, almost a year ago, I did a presentation that had a significant number of views, which was talking about the heart failure epidemic. This was more than a year ago. And this was an epidemic that I predicted based on the fact that I knew autoimmunity was an important part of the disease, and any kind of immune intervention could exacerbate that and affect specific organs. And at that time, I was focused on the heart. In truth, it seems to be coming true. And what I'll be doing today is very quickly highlighting this important article from the British Heart Foundation. And you can see it here: early heart disease deaths rise to a 14-year high. So I'll capture a few points from that. But before I go into that, what I'd like to remind you all about is that there was a really critical paper that was done in September 2023. This was looking at the specific uptake of glucose, labeled glucose in the heart, comparing vaccinated and unvaccinated patients. A really, really important paper. I sat on this paper for about 3 months because I knew how important it was and I really needed to reflect on it. So I then put together a whole presentation. And if you're interested in it, this is where it is. The link is below. And you can see there is a discount on the course. And then what you can see is that I went through in detail looking at all the characteristics: structure, energy use, what the PET scan is, the change in use in energy in the heart in heart failure, looks at myocarditis, mitochondrial failure, free fatty acids. So, looking at a number of mechanisms that could be related to why this was occurring. So, this was a really, really important paper. And as I said, if you want to see the course, it's in the description below at a significant discount. So, very happy for you to join me on that journey. Here is some of the points that I think that are really important. And again, this is taken from the course. I'm just capturing some of the points here. And you can see here, this was one of the slides that I put together from the paper. And it was comparing the two groups. This was a 43-year-old male, an 80-year-old male. These two were unvaccinated, and then a 38-year-old male and a 72-year-old male who were vaccinated. And this was just giving an example of what they were seeing. This is the heart, and this is the normal heart in terms of it doesn't tend to use glucose. But for some reason, up to almost 6 months after, you're seeing very high uptake of glucose in the heart. And this is what it would look like in the red, meaning very high usage of glucose in the heart. So I knew this was a standout observation, meaning that it's not something to ignore. It's what we would call a hard observation, something that means something significant. We don't quite know what the longer term implications would be. So that is a different question. But what you don't do is ignore it. And so I detail in there some of my thoughts as to why it could be happening, especially in the vaccinated heart versus the unvaccinated. So it does happen in the unvaccinated heart as well, but this was twice as frequent and much more significant in terms of the degree in the vaccinated heart. And that was a really important point. But bringing us back now to where we are, this then aligns with what we would be seeing here. So at this point, the British Heart Foundation is recognizing that heart disease deaths are now at a 14-year high. And this is after they've had a period of significant reduction in terms of heart disease. There was a trend that was going downwards since about 2008. And so we see this important trend that is going down over the past number of years, and then the pandemic comes and the trend starts to rise. Now, there are many things that could cause this, and this is where you have to be objective. And so you can see here that they highlighted that they agreed that more analysis was needed to understand it, but they highlighted that there were likely to be a number of key factors including an increasingly unhealthy population. I wouldn't disagree with that, but I can't understand why suddenly in 2 to 3 years, this normally takes 10 to 15 years. But anyway, we have here widening health inequalities. Very true. Over the last decade. Over the last decade shouldn't cause this kind of transition in just 2 to 3 years. So, again, whilst that may be relevant, it's unlikely to be the major factor. And then again, we have long standing and extreme pressure on the NHS, but the trend was downward all the way up to the pandemic. So, even though that pressure was there, and there was certainly a lot of pressure around the pandemic, it wouldn't cause that much of a change. And of course, then they mentioned the COVID-19 pandemic and potential effects of COVID-19 infection. Now, as I mentioned previously, I don't know how anyone seriously looking at the science can ignore the elephant in the room. That's the question that I don't understand. Why in the world would you say all of that, including all of these potential factors that are real potential factors, and you do not mention the elephant in the room? That's where we have a problem because if we don't acknowledge it, there is no chance of mitigation. It's not whether it's right or wrong. You just have to have it on the table. Until we change this approach to science and until we have an ability within the scientific community to ask questions, how are we ever going to resolve this? This has real impact in the context of the patient. Here is the reality about heart failure. Heart failure, that means when the heart is not pumping, and I cover this in the course, it's just not pumping well enough, or there's too much pressure in the system. It can't overcome the pressures. When we look at heart failure where the heart is just not pumping enough, either systolic or diastolic, where the heart can't expand enough, when that occurs, we can only tweak the edges. We can't reverse it. And so it's extremely important that if this is occurring, we recognize it quickly and we mitigate it. It's risk management. That's what most of medicine is about. You don't ignore the elephant in the room. That is the sad part at the moment, is that there is still a fear. Even when they recognize a 14-year high, there is an inability to even put it on as a potential factor. Now, what can we say? It means, therefore, the chances of us finding answers when there are some things that cannot be questioned is unlikely. And therefore, this is going to happen. I mean, how can it not happen? When you think about the mechanisms, and this is what I said in terms of the presentation, I was looking at as many mechanisms as I could, and it was fascinating to look at. I was looking, well, this was just about the structure of the heart, but looking specifically at the mitochondrial function in the heart, why it's so important, looking at how the heart uses energy, and the fact that it tends to use fat instead of glucose. Rarely does it use glucose. And so a transition to using glucose is usually an indicator of disease. So, what would make the heart do that? What would make it go from doing the normal pattern to something else? And this is what the numbers look like comparing the unvaccinated and the vaccinated in terms of the severity. So you would consider this to be your baseline in terms of levels 1, 2, and 3, 3 being the highest uptake. And you can see about 50 out of 300 would have 3. In the vaccinated cohort, which is 700, so it's a bigger cohort, it's over 200. So if you were comparing, this is more than double, 100% increase in the most significant uptake of glucose. There is no way that should be ignored. And this is where we are at the moment. We need to find answers, but we have to be able to do it in an environment where there is a willingness to accept and acknowledge if there are problems. And sadly, politically, and even within the scientific community, there is a reluctance to face the fact that there may be the possibility of harm. There are too many people who would be affected, and so no one wants to look at it. And believe me, history tells us when that occurs, and you just have to go back to the late 50s and the 60s and think about how many babies were affected the last time this kind of thing occurred at a significant scale, and the outcomes are horrific. There is very little else we can do but continue to ask the questions. And that's my job at the moment, is that I just raise the questions. There is a responsibility for regulators to challenge and check it. Make sure that you're not missing the elephant in the room. Because if you are, and it turns out that it was simply a failure of looking, at that point, you can't say it's a mistake. That's equivalent to criminal negligence. We don't have any options at this moment but to find solutions. Everything should be on the table. Everything should be investigated. There is nothing that should be off the cards that can't be looked at. Until that kind of science is changed, we are in trouble. Have a good evening.